From Quitman County, we have Miss Amelia Coleman. She is a Lackey Scholar. She's a member of the Beta Club, and she's an athlete. From O'Bannon High School in Greenville, Washington County, we have Ms. Jacqueline Hanna. She is a member of the Mississippi Youth Council, which is helping her to become a youth advocate. Well, she's already a youth advocate, so just helping her to hone those skills. And she's also a member of the local mayor's youth council. Miss Madison Steer is also of Greenville. She is a student of Greenville High School. She's a member of the Beta Club. She's the captain of the cheer squad. She's part of the Progressive Arts and Cities Club. She has a lot of other stuff going on. One of the things I tell people now is the young people schedule a lot of more than we have to schedule around, because they're not sitting around doing nothing. They are making sure that they are active. We have Mr. Jalen Watson. He is a senior at Madison Palmer High School, and he lives in Kahoma County, but he gets to experience Quitman County during the week. And then we have Mr. Hendrick Jamison. Mr. Jamison attends Palmer High School, and he works. So you also, what are your sports?
Basketball and football.
Basketball and football. He's a dual athlete, and he still maintains a job. So we're going to hear from these young people. So my first question to all of you is, what is one thing you love about the Delta?
What I love about the Delta is the hospitality. They are. One thing I love about the Delta is their hospitality. My favorite thing about the Delta is probably like our family and connection that we have here. The best part about the Delta is the tight-knit community where everyone feels like family.
My favorite part about the Delta is growing up on the culture at this state was built on. My favorite part about the Delta is the landscape. Really fun to look out.
So this is a question that I would like for each of you to answer as well. We are talking about most basic needs are food, clothing, and shelter, which is housing. What is it like for people in your community to access food, clothing, and shelter?
I feel like everyone has access at least to the basic three. Maybe not the quality of it, but quality over need, I guess. But I feel like everyone has access to it, or you just don't know the resource. If you don't have the access to it, there's other ways that you can access the food. I agree with her, but I feel like for the homeless people, that they don't have access to now three of those, and I feel like that if we like get out to put it out there for them to just come out or and feel the love from us and not just from where they come from.
I second that as well. But I don't think everyone, I think we have access to the three necessities, but I think us in this room can, like one day we can like start an organization, or this organization here can, implement like ways that people, homeless people, like she said, or anyone that don't have the resources for these necessities, we can invest into these communities so that they can get these access to these people.
When we all come together as a community, then we can get things together. We have the access in most areas in Mississippi, but the quality is very different in most places. Like for example, Clarksdale, Kahoma is very different. Food options, clothing as well. March, Mississippi, not so much. We have grocery stores, the food options as well as the housing as well. But the quality is very different from other states, other places, other regions. So the quality is very different.
I agree that the quality is very different. For these resources, we have access, but the resources limited. From us having to go to a neighboring county to get these resources, and how are we gonna get to these counties and stuff like that? And the housing is very limited as well.
So some of you already answered my follow-up question, which is what do you think needs to change for everyone in your community to have access to those basic needs? So I'm gonna piggyback off the Nelia. And the next question is, we're familiar with the fact that many people do have to drive 20 minutes or more to get to school, work, to get access to healthcare. And then when I was talking to you, most of you all stated that you go to Cleveland to go to the bowling alley and to the skating rink, and that's about an hour away from some of you. So how are youth and young adults feeling their needs for transportation, especially those that may live in a household that does not have a vehicle?
I'm gonna go first. So I'm a part of Teen Health Mississippi County. And so we had the advantage to come up with our own advocacy project. So mine was Service Council in the Mississippi Delta. So I recently hosted, a little my project, it was at my school, and I educated 100 teens about Service Council. So, recently we went to the Capitol, I think, last month, right? We went to the Capitol, we spoke to different House of Representatives and senators. And we talked about like different bills, mental health, having nurse practitioners. And one thing about my project was we have to travel for healthcare. Like we have clinics and things in Washington County, but for certain things or that specific thing that you need that needs to be taken care of, we have to travel to Jackson. So for that, like some people have to carpool or they need transportation or things like that. So I think for me, I think that needs to be worked on. Like for the previous panel, they was talking about that people leave the Delta. And I think people leave the Delta is because there's nothing here. But we was to come back home and get these things and bring our knowledge back to Delta, we'll have places that we don't have to travel.
Well, good.
It is so important that we have generations before us to cheer us on.
Yeah, keep back up on him. She spoke about carpooling. So yeah, that's another thing, like making relationships, I guess, in your schools and things. So, and like different organizations within our county. Sometimes they have access to vans and things of sort, if you all go as a group or, together. Cause we don't have like Uber or Lyft like the metropolitan area, so we can't book one of those and so you have to get in the car with our friends or, ask an adult or, just that community person you have or a church member that doesn't mind to take you all or, to places like Cleveland, the bowling alleys and things of that sort.
And then, time to time, your parents will be at work, so like, it really ain't the other way around unless you ask a parent to take you somewhere. And then gas prices, that's another thing, gas prices. Yeah.
As a youth that lives in a home that does not have a transportation, we do have to ask family members, and stuff like that. So it's really hard trying to get around living in a household that doesn't have transportation and having to ask family members or anything such as that.
And another thing, see, I stay in Washington City. I live on Riverside. When I don't have transportation, I try to call around and get somebody to come get me. If I can't get nobody to come get me, I'm having to walk from Riverside to the high school, to the high school, to the.
That's the town. That's the town.
You gotta get on the bike.
So we are hearing that relationships are very important. That is definitely a thing. And so Jacqueline talked about people having to drive to get health care. One of the statements about healthcare in the Delta that I heard while I was talking to these young people in previous conversations was, it'll get you by. How does the limited availability of healthcare specialists and mental health services affect families in the Delta? And how might that influence a young person's decision to stay in or leave the Delta?
Well, I'll go first. Yeah, like you said, the healthcare opportunities or availability are pretty limited here. Well, we do have other
I guess, organizations or workplaces like mayor and council, but that's like within the school systems where the kids can talk to, the different people that work with them, talk about their problems and things going on in the household, parents, siblings, or however it goes. But I do feel like the lack of mental health services, it does create like a feeling of isolation within our town, and that kind of like drives us away or to another place where we feel home, or because some people don't have the same, I guess, feelings in different households, and those mental health services that are needed is kind of sort of like an outlet, so, and with the lack of those, it drives them away to find it elsewhere, and because we don't have it at home. That's right.
Yeah, I love the topic of healthcare. As we know, we have a nursing shortage that's nationwide, a limited healthcare facilities all across the state of Mississippi. Medicaid expansion for lower income families, that's all many problems concerning healthcare. So I believe that it's affecting our people as people of color, people of all colors. It's affecting us in a major way. For many years, Marsh, Mississippi, went without a hospital, a local hospital. That has majorly impacted the life expectancy, lifespans of many individuals within that community. It has caused many deaths. We should not have to travel 30 minutes to an hour to get to a long-term healthcare facility. We have plenty of local clinics with nurse practitioners. That is great, but they can't provide that long-term care for more serious cases that our families face. We lose family members, we lose friends, we lose classmates. It's a severe problem within our state and needs to be addressed.
Right. I'm going to second medicine about mental health. So when I say I recently went to the Capitol to talk to different representatives, we actually had a bill about mental health to incorporate it in all public schools in Mississippi, but it died in committee. It was House Bill 928, and I think the person that wrote it was Representative Rosebud. And that's sad to say that they don't want, I'm not gonna say they don't want it, but kids actually need people to talk to. Like they want screenings inside the school to see like what's actually going on. Why is this child feeling it? Oh, they say they're feeling because, oh, they just bad. They want to live in the world. But actually, this something mental can be going on with kids. And it was crazy, and I was kind of upset that House Bill 928 wasn't passed. And like that, it just been crazy. So,
So certification did come up in the previous panel, and that's definitely something we want our young people to be involved in. So we commend you all for the work that you are doing, the conversations that you are having. And sometimes I feel like I talk a lot and I might not be getting things done. But one of the things that I have realized is that in every room that I go in, I'm planting seeds, or I'm watering a seed that has already been planted. So together, when that flower bed is gonna look so good when we all work together, and it's gonna be a beautiful thing. So we're gonna ask one last question, and then we're gonna move to Q&A. In the same question, if you had unlimited resources and you could make the Delta anything you wanted it to be, what's your biggest dream for the Delta?
Better building, and more activity.
I would say there's two more activities, and the community garden that was down here. I feel like that we get that community garden back, we will have people coming out, getting free vegetables, free vegetables and fruits like they was back then before that community garden got destroyed. I will add on to what they said. I believe that we should have better road systems, better internet access, because with internet access, that's with our everyday life. We cannot connect with people without internet. Road systems will help bring in people to want to fund, want to bring in businesses so that we can expand our county, make our county look better, so we can have more job opportunities for our people.
all right. I really agree with what they said as well, but can I ask what's your name with the afro?
Shakira.
Okay, so I heard that they ran for office, and my biggest dream is to run for office in Yeah. Plan to run for office, and I'm gonna incorporate what everyone said. I plan to be the voice for women, children, the poor people, Black people, underdeserved community, and racial and gender inequality. So that's what
Yeah, well, I don't know how I'm gonna come back from you can do it, man. Crenshaw, wait, I'm actually gonna pick back off of what somebody else said. Miss Crenshaw, I was listening to your speech about the children having somewhere to like a pathway between adults and teenagers conversing. I think that we lack that a lot, like, and we need that to grow like into adulthood. Like, I'm a senior in high school, so I mean, I do have the resources at home. I have a mother and father who care, but the ones that don't. I feel like there's a really big important part in school, and those that don't know and those that need it. I think we need that conversation between adults and teenagers.
That's right.
That was some great response. I'm gonna be a little more simple. I'm big on healthcare, so I believe our funds need to go. We need to pour into healthcare. We wonder why our lifespans and expectancy are so low. We need to pour money into our healthcare. We need more facilities, more help, more nurses, more doctors, more professionals. I plan on going to healthcare professional. Well, plan to be a healthcare professional. So I hope the money and the funding be poured into that. Also, we need to pour the money into our children. If children are our future, we should give them the opportunities they need to grow. They are our future. We need them to be better. We need them to grow. So pour our money into healthcare and to our children.
Thank you all so much. I want to ask you all to stay in place, and then we may have a few questions for our previous panels as well. So we want to go ahead and start taking some questions from our audience. And it looks like we have a question on Zoom.
Yes. Can you hear me?
We can.
Okay, this is Raymonda Delaware in Yazoo City, Mississippi, a Dream Innovations. And first, I want to commend all of you because you all are amazing. Just listening to you and how you are open and willing to share all of your insight, that's exactly what is needed. So, my question is, I would like to know what each of you plan to do as far as where are you looking, what type of career are you looking to move towards? And I also want to say Dream Innovations is moving. We're in Yazoo City and we're focusing on Humphreys and Holmes counties, but we are expanding to other areas throughout the Delta because our goal is to transform the Mississippi Delta with innovation and technology. So we are looking for you all to be a part of that as well. So I need to hear from you ladies and men. I can't see the other end, but I do want to know what your plans are after school. I know I saw one medical field and politician, but I would love to hear.
Okay, I plan on going into the medical field. I start off as a nurse. They are at the forefront of patient care. So being a nurse has always been a dream of mine. I don't want to just rest there. I want to go as far as I can go. I want to go as far as the doctor even. I want to CRNA. That's my goal. So
Is that what a CRNA is?
certified registered nurse anesthetist. They can work in local clinics, hospitals. So it can be like, in between hospitals and clinics. I know everybody can't reach that level of health in certain hospitals as well. So I want to be like very versatile in the healthcare field.
I plan to become a gynecologist. I plan to attend the University of Mississippi and major in journalism. I plan to major in journalism with an emphasis in political and social justice, and I plan to become a political journalist.
All right. I plan to become a lawyer. I don't know which lawyer do I want to be, but I want to become a lawyer because there is not a lot of women lawyers that's recognized for what they do. It's always men lawyers.
Mhm.
Women are always put at the bottom, and I am one of these. I am currently in college at CCU, and my major is Bachelor of Science in Administration Business, and I plan to have my own school. And my school will be based on children with different disabilities and different things that they have to work with without having to go to a public school to try to fit in because they not smart or they can't get this and do that.
All right, girl. All right, fine. I'm gonna take over my dad's business. I'm gonna be a little poster work.
We'll take our next online question.
Y'all are amazing. Absolutely amazing. So thank y'all so much for sharing today. I was sad to hear that the legislation did not make it out of committee. I am aware that there's another mental health bill that was passed out of the Senate that would create a mental health task force. And that sounds like something that Youth Voice needs to be a part of. I'm wondering, what are some of the mental health services and resources that every single school needs? Like, what would you say to legislators? Like, this is what my school needs.
I was just gonna say, what she said down there about the having people with disabilities. We don't really have any services in my school with to help the people with disabilities. So I think they should be opened up more and brought to school.
So one of the things that Danelia did point out when we had our one-on-one conversation is there are mental health services that are at the school, but sometimes young people don't know about them, or they are reluctant to access those services. And then I think, Madison, you told me that sometimes young people may need somebody to connect them with those services. So those are some things that these young people have pointed out.